Joshi, congratulations on being selected as one of the top 3 pediatric optometrists for Pickering.
Thank you. Thank you so much. It's truly an honor to be selected for this award.
Yes, that's amazing. We'd love to know what inspired you to specialize in pediatric optometry.
Yeah, for sure. So, well, first of all, I love working with children. I have a little one of my own at home.
Aw,
And, the earliest years of your life are the most critical years
yes.
from a developmental standpoint and a learning standpoint.
Mhm.
And learning, as you know, you may have heard, is actually 80% of it is visual.
Mhm.
So, as an optometrist, we have the honor to help ensure every child sees their best. And I find it really rewarding that we can have such a positive impact on a child's life by helping ensure that they see their best so that they're set up for success in life.
That's lovely. And how has Seaton Vision Care grown in Pickering?
When I established this clinic, I had one intention, and that was to provide a personalized experience for our patients, where families felt comfortable bringing in all of their loved ones for their eye care journey. We opened back in 2020, right after the COVID lockdown, and since then, fast forward 5 years, we have grown organically from the referrals of our own patients, along with collaborations with local healthcare providers.
That's wonderful. The citizens of Pickering are very lucky to have you.
For sure, and I'm very grateful to have them.
Now, Dr. Joshi, we'd love to hear about some unique vision challenges the children face due to lifestyle and environmental factors.
For sure. Now, on a daily basis, I'm seeing a really large increase in myopia, also known as nearsightedness. The way children are growing up today is very different from when you and I were growing up.
Absolutely. Yeah.
There's a lot more time spent in front of digital devices, a lot less time spent outdoors in natural sunlight, and as a result, we're seeing a large increase in nearsightedness, and we think that those factors are directly related. Along with that, I see a lot of children with red eyes these days.
Interesting.
We always talk about pink eye. Well,
Yes.
pink eyes are not all the same, right? It could be infectious, it could be inflammation, it could be allergies, and it's hard to decipher between the different types until it is evaluated by an eye care provider. So I can't emphasize enough for parents that they should bring in any child with a red eye to the eye doctor and have them checked out so that it is accurately and diagnosed and accurately treated.
Yes, that's very informative. Thank you. Now, Dr. Joshi, have you encountered any unusual or peculiar eye conditions that have surprised even you?
That's a great question. Unfortunately, these type of cases come up more than I would like. I'll share one example. We got a healthy child coming in for the routine eye exam.
Yes.
Child covers the left eye, sees 20/20, has perfect vision. Covers the other eye, and the child can't see anything. Not even the big E. Everyone's caught off guard because no one saw it coming. But that child has a lazy eye, also known as amblyopia. And it's very important that we diagnose these cases and catch them early because they can have lifelong consequences.
Very interesting to know. So, at what age should parents schedule their child's first eye appointment? And why is early detection so important?
So, the Canadian Association of Optometrists actually recommends a child be seen at the age of 6 months. But I usually tell parents, bring in your child before they turn 1 for their first eye exam. And then, they should probably have another one by the time they're 3. And then once they start school, usually around the age of 4, I recommend an annual exam from there on. Children grow, and as they grow, their eyes change very quickly. So it's very important to, keep up with that cycle. Why early detection is important? Well, most eye conditions, if we catch them early, they're treatable.
Okay.
But if they're missed, they can have lifelong consequences, and a lot of times the defects associated with those problems are permanent. So, setting them up for success is very important that we catch and treat early.
Absolutely. Now, Dr. Joshi, with the rise of digital screens, I'm sure parents would love to know how can they protect their children's eyes while keeping up with the modern education system?
For sure. I love this question. I think I get this asked on us almost on a daily basis.
I'm sure.
Well, screens are here to stay,
Yeah.
and children are spending a lot more time on screens, more than ever. These screens have been incorporated into the school system already, but I always encourage parents, it's our job to cut down as much as possible. So at least if we could try to cut down the recreational screen time, and encourage the child to take part in other activities like arts and crafts, sports, or even just playing board games. And if a child's watching videos, if we can try to move those videos away onto the TV instead of having the child watch them on an iPad or a phone, and also incorporating visual hygiene. So what I mean by that is, considering how the lighting is, considering how far the child is sitting from the device, and the angle, and also incorporating breaks. I always tell my patients, take a break every 20 minutes, look 20 feet away and blink 20 times. That really helps relieve eye strain and promotes well-being for the child.
That's very good to know. Thank you for all those handy tips. Now, for all the parents out there, what's one piece of advice you wish more parents knew about their child's vision development?
Most parents assume that their child is fine, whether because they had great eyes, or because your child doesn't complain. But you cannot live by that assumption. It is very important that parents bring in their child and get their eyes tested, even if everything is okay. On a daily basis, I see a lot of children that come in without any concerns, and they've got various problems. Parents, you have to remember, the environment that these children are growing up in is very different from what we grew up in, or what our parents or our grandparents grew up in.
Yes.
And because of that, children's eyes are changing faster than we can expect. In addition to that, there's a lot of children who have a problem in one eye and their other eye compensates for it. So they can go on living normal lives without having any issues, but that's not healthy, because we want both of our eyes to be working well together, and we want them to be working in cohesion. And that is only possible if we test our children's eyes at a young age, detect them, and treat them if necessary.
That's excellent. That's good to know. Could you please share what role does proper nutrition play in maintaining good vision for children, and what foods should parents focus on?
I always tell parents, try to incorporate a healthy diet. Let's avoid junk food. Let's cut out the processed foods. Ensure your child's eating a well-balanced meal full of, fruits and vegetables, especially leafy greens. Incorporate foods that are rich in antioxidants. Those are great for your eyes. And ensure that the children are getting enough of their omega-3. That helps reduce dry eyes.
Okay, very interesting. Now, Dr. Joshi, bringing you back to your clinic, are there any new pediatric eye care treatments or technologies that your clinic is excited to introduce?
Yeah, for sure. So other than your primary eye care exams for children of all ages, we specialize in an area called myopia management. This is specifically for those children that have nearsightedness that keeps getting worse year after year. It is a group of treatments that not only correct the child's vision, but also slow down their progression. Both the refractive, so the prescription of the glasses, but also the length of the eye. So we have a special device that actually measures how long their eye is, and we can track that over time to see if a child's eye is growing at a normal pace or an abnormal pace. And our range of treatments include eyeglasses, contact lenses, and eye drops that we can prescribe, which, like I said, slow down the progression both from a prescription and an eye length perspective. We launched this program 3 years ago, and we've seen some tremendous results. And I look forward to continuing to provide this service in the years to come to our growing population.
That's an excellent addition. I wish we had this when I was growing up. Dr. Joshi, you're clearly very passionate about the work that you do, but we'd love to hear what sets Seaton Vision Care apart from the other clinics, and how do you ensure the best care for your patients?
So when I take on a patient, I like to treat them as if they're a member of my own family. I try my best to personalize the exam and to cater to their individual needs. And I like to incorporate a lot of education into my eye exams. I want the patient to understand what I'm checking for, why I'm checking it, and what it means to them. For emergencies, we try our best to incorporate and see them fit them into the schedule, even if we're fully booked. And for a lot of my patients that have recurrent eye problems, I've given them a number that they can use to reach out to us after hours when the clinic is closed, so that they can get the help they need if something happens.
I must say, you truly go above and beyond. And once again, congratulations on your award. It was an honor to speak to you today.
My pleasure. Thank you.